So as we're starting to assess our breathing, especially prior to our core work, we want to make sure that our entire abdominal canister is working all the way around. We have a couple of different ways we can monitor this. One of the most useful ones, especially if we're not doing anything with our hands, is going to be the forefingers kind of going into the, kind of like just inside the ASIS, into the obliques, and then the thumb sitting in the posterior lateral spine to make sure we're getting some expansion into the posterior wall, the kind of the abdominal wrap into some of the lower back musculature. So we can put our hands in those spots. We just take a deep breath in and out. And we want to see, do we feel even air into all of those four spots, like the front corner right, left, and the back corner right, left. If we don't, you can try and direct a little more breath into either the back thumb or the front forefinger to get everything going. Now, as if we breathe, if we start with immediately kind of like this, we're kind of like decoupling our rib cage from our pelvis, which does not help our abdominal contraction and our core work. So one of the other things we need to notice is, in addition to is our air going into here, is it actually going up into here at all, or are we kind of elevating the chest, which is just going to throw a bunch of tension into our neck. So as we breathe into here, we want to see, is everything working well? We can also put the hands on the side of the ribs to see if we have a little bit of lateral rib excursion, because that helps also. So we can just sit here and we can work on this. If we tend to go towards the upper chest elevation, we can always put a hand here too, just to make sure we don't get the hand kind of closing in on the chin. That can help a little bit also. So we can just sit here and just do 5 to 10 or 10 to 15 solid breaths in and out. We could do it for a time, 30 seconds to a minute or more. And as soon as we get this down, we can then progress to some of our core dead bug positions, kind of 3-month both legs in the air, and see where we can progress until we start to lose some of this pattern, which should be the threshold of our difficulty. Hope that helps. Have yourself a good one.